thank you so much, Dean Lushniak, for coming here. And it's like really exciting to have a dean who's like so involved and just has such an extensive background in public health. And like you're just such a distinguished leader in the public health field, like with responding to different public health disasters from 9/11 to the 2009 H1N1 flu, and then also the Ebola outbreak in 2014 to 2015. But I'll just give people some background about me, I guess, because people are probably like, why are you even here? And that's a valid question. My name is Kelly Sherman. I'm a junior public health science major at the University of Maryland. I also am the director of health and wellness for the Student Government Association, which I take a lot of pride in doing. And our job is to promote the physical, nutritional, and mental health of the undergraduate body. So that's very exciting to do. Also, I'm in the Student Health Advisory Committee for the University Health Center, Gamma Phi Beta, and I'm the chair for the Mental Health Student Advisory Board on campus. That's just like a little background about me. And I love being in public health, especially now. It's such an evolving field and it's constantly changing and there's never a dull moment. And I love that. It's exciting to just be a part of like figuring out problems from like a huge perspective instead of just the individual or like the molecular level. So yeah, that's just a little bit about myself. But Dean Lushniak, if you could introduce yourself, that would be amazing.
Sure. And my name is Boris Lushniak, and several things. First of all, I'm the Dean of the School of Public Health, been there for 3 years. And that all came about after I had spent about actually 28 years in federal service, 27 years in the uniform of the United States Public Health Service Commission Corps, spent 16 years at the Centers for Disease Control and Prevention, and then had spent 6 years at the Food and Drug Administration, running an office called the Office of Counterterrorism and Emerging Threats. So this was something I worked on 10 years ago in terms of the 2009 H1N1 pandemic. And then subsequent to that was in the Office of the U.S. Surgeon General for 5 years, where I served as the acting U.S. Surgeon General for 1.5 years and a Deputy Surgeon General for all those 5 years. So for me, I look at this as a public health practitioner, now honored and humbled to be in the world of academia at the University of Maryland, with the idea that what I bring to the table is, in fact, as Kelly mentioned, some of the experiences, right? In my career path, you know, sometimes you look at it, is it a curse or a blessing to have had those experiences? I look at this as what history gave us, and we in public health had to react. So just in this century alone, it was World Trade Center where I was a responder. It was the anthrax bioterrorism attack where I was a responder. It was Hurricane Katrina as a responder. It was the 2009 pandemic of H1N1 as a responder. And then also a responder for the Ebola epidemic, specifically in Liberia, where I spent 3 months of my last deployment. So when I look at what's going on here, it's really from that level of experience as a practitioner of public health, but also now as a dean, realizing what Kelly here is trying to achieve is, let's talk about this, right? And let's talk about not only the science and what we know, let's talk about what we don't know. Let's talk about the fact that this affects people. People are dying and they're sick. And when we in public health, you know, need to have that empathy and the understanding. Let's talk about the physical, the mental, and the social well-being of our campus community. So that's a little bit about me. And now Kelly's in charge of all this.
Yeah, so thank you so much for talking about yourself. I feel like it is very important just to hear from different like campus leaders, like talking about the social and like physical well-being of students in general, and like how this issue is so layered and so multifaceted, and like you've been in this like field for so long, and this is still like a very changing issue, and you're constantly learning new things about like how to react to different like situations like COVID-19. But if it's okay, I would love to ask you some questions that are submitted by students, if I could get your feedback on them and if you could answer them to the best of your ability. Awesome. Perfect. So first, I was just wondering if you could like talk about like COVID-19, like the pandemic, as a public health leader, and like where we are right now, so students can have like that sort of background knowledge.
Great. And so, you know, it's a fascinating time. So despite the fact that it's scary, and it's scary for all of us, right? Even as a public health person, right, who has seen a lot, it is scary to a large extent because it deals a lot with the unknown. right? And so COVID-19 is a brand new virus. That's a key component of this. This is something that we as humans, as humankind, have never seen before, right? The virus itself is actually not called COVID-19. The virus is called SARS, S-A-R-S dash CoV-2. And it is related to another coronavirus, which is in the SARS family, the severe acute respiratory syndrome, which was another disease that we had. And I will sort of back us up a little bit and be brief here, but I want everybody to understand where we're at with this whole coronavirus thing. So anyhow, brand new virus. It was first, the world was notified of a brand new virus, right, by the Chinese. And this came on December 31st of 2019, just as all of us were ready to celebrate the new year, is when China basically notified the World Health Organization saying, we have sickness going on. We knew that there was something going on there, and they had identified a brand new virus never seen before in terms of causing human disease. Coronaviruses exist out there. This is now our 7th coronavirus that we have discovered. It has become apparent in terms of causing human diseases. There are various coronaviruses that cause animal diseases. And that's one of the important aspects is where did this come from? It came from the animal world. And we have animal diseases called zoonoses that usually just infect animals, right? And this specific coronavirus may have come from the bat family. So think of it, a bat gets a cold, right, spreads it to another bat, so it doesn't really bother us, does it? Well, until there's a change in that virus, and the change occurs, it could be a mutation, it could be other things, that all of a sudden a person becomes susceptible to that same bat virus, right? And then maybe another change where a person now can spread it to another person. That's what's probably taken place with this coronavirus. So December 31st, first virus, we already knew that there were people getting sick and some were dying in China. We were all monitoring those numbers. Yes, it was in the press, and yes, there was some activity going on early on. And, you know, to some extent, we kind of thought to ourselves, okay, let's monitor and let's not hope that this is going to become a worldwide issue. Although even back then, many in public health were already saying, boy, this is one to watch and let's keep our fingers crossed. So we know this is number 7 coronaviruses. What about the other coronaviruses, right? There's coronaviruses, 4 of them have been identified as causes of the common cold. So we've known about them. Not all colds are caused by coronavirus, but 4 of them do exist as common colds. 2 more just came up in the 20th century. One caused a disease called SARS, severe acute respiratory syndrome. That appeared in 2002, 2003. It spread a little bit to various countries, started in Asia. It basically, we only had a handful of cases. I think there were 8 cases in total in the United States from SARS. The closest it came where was a problem was up in Toronto. It caused the fatality, so death rate of about 9.5%. So this was really problematic. And then it just disappeared, totally disappeared. Don't see it anymore. 2012, 2013, we had another coronavirus causing a disease called MERS, M-E-R-S, and that's Middle Eastern Respiratory Syndrome. Same thing, sort of came along, was a big killer. To about 34% of people who had MERS ultimately died. So it was a real big killer. And it spread again, various countries throughout the world. We only had, at that point, 2 cases in the United States. MERS hasn't completely disappeared. Even last year, there were still 5 cases that were identified in Saudi Arabia, right? So MERS is still out there. So we've had that experience. And then this year, this happens. And what happened was this one is a little bit different in that human-to-human transmission is quite apparent, right? People are getting it from people. And right now, if we do sort of the mortality rate on it, and this is a crude number, we can talk about that later, but these are all estimates. I really don't know how many people have really had the infection. And part of it is the lack of testing and all that. But part of the issue is that right now, about 4% or so, if you run the numbers, 4.5% of people with this disease have died, right? And it's very sad and very tragic. In Italy, we're seeing the death rate even higher, 9.5%. In the United States right now, we're about 1% or so. So the question is, why is this all changing and why is it? This is an epidemic that started in China and now has become a pandemic. And the term pandemic has no real strict definition. All it means is a worldwide epidemic. We know that this has really shot up. We know that, you know, it went from single digit cases in China to now, as of yesterday, I'm just looking at the numbers from yesterday, almost 400,000 cases worldwide with almost 20,000 deaths, right? And that's in a matter of 3 months. So, you know, that's kind of where we're at right now.
Okay, thank you for like framing that entire world view. I think just like going off of that as like a sub question, I am very like interested in how like the different epicenters like start. So I was wondering if you could just like talk about like why certain places are like hotspots, or like what the transmission looks like from those places like going to surrounding places.
Right. So let's start at the beginning, right? At the whole sense of what happened in China. And again, these are all presumptions, right? They're always looking at the ideas. How does it get from an animal to a human? Well, we know that in different cultures, you have food markets and live food markets, live animal markets. So the presumption here is it may have started in the food market in China. So that first sort of expansion between the animal world and the human world takes place. Now, as people get out, and the way it's transmitted from individual to individual is, you can imagine me with symptoms. Let's say I don't have symptoms right now, I'm fine. But if I had a fever, and that fever comes with a congestion, with a cough, a sneeze, the transmission is aerorespiratory route. So anytime I cough and sneeze, and I'm near a person, guess what? I shed those viral particles that have infected me. So what's happening in China is people cough and sneeze. And certainly if they're living closely together, if they're, the magic number is 6 feet of each other, how's the 6 feet come up? Well, it's basically what we know about the physics of these particles, right? If I really have a really bad sneeze, and I'm not going to mimic one on TV right now, but it can be kind of gross, right? All of a sudden,
exactly.
I'm splattering. Well, the big particles fall rather quickly. The little particles can spread, and they can spread as far as 6 feet away, right? And if you're sitting there and happen to breathe in, sounds gross, but this is part of the transmission.
Yeah.
Breathe in, this is what happens. Then I can get infected. And that's how it sort of began. The other issue, and this is why we push a lot of these public health measures, is what? If I sneeze the old-fashioned way or cough the old-fashioned way, right into my hand, now it's in my hand. And guess what? Next time I see you, I shake hands with you. Guess what? Well, it's on your hand. Now the third way, right? All of a sudden, I take that hand and I touch my nose or I touch my mouth. Now I've gotten it that way. So that's what starts happening early on. Obviously, early on in this epidemic, when it was strictly an epidemic, we're looking at China. It's being spread from person to person, and the numbers are growing quite rapidly. Now you throw in the issue of a cruise ship, right, with a few cases on there. We follow that news. Now you talk about potential of a traveler going to another part of the world, to South Korea or Japan or elsewhere. Now you talk about someone going to Italy. And what's really scary about this is that, in essence, it's spread pretty easily from person to person. And that's what we're most afraid of. So this whole transmission, the worldwide transmission, really comes because the world is a smaller place, right? The last time we had a pandemic of this severity, right, and it's still hard to determine how severe is this going to be, but we're concerned about the modeling and the numbers right now, was 100 years ago. 100 years ago, 1918, 1919, there was something called the Spanish flu. Right? And that killed upwards of 60 million people across the planet. I hope it's not going to get as bad with this one, but that's been 100 years since we've had such an issue. So for all of us, this is all brand new. This is all brand new, right? So anyhow, this is important.
Definitely.
I'm seeing a comment on there, and I think it's an important comment. Mythbusters says sneezes can even be up to 16 feet. And you're right. I mean, the small particles that are out there, if you're sort of tracing the tiny particles, what we're finding is that it's not just the particles, it's whether the virus is embedded in those particles. And part of this may be related with the idea that, with the idea which is how much of a dose of those particles do I get? So 6 feet is sort of the rule that we're following because it seems that maybe there's a dose relationship. If you're 16 feet away, you may get less of it and hopefully not get infected. Back to you, Kelly.
Okay. Yeah, no, that sounds great. So here, I just want to go into some questions that students submitted just to be courteous of them taking the time to submit them. The first one comes from Chidalu Mabanu. She's a public health science major, and she was wondering like why healthy individuals aren't asked to wear face masks when there's possibility that although sick people are asked to wear a face mask to prevent transmission of their illness when they cough or sneeze, um, and not even know that they're sick enough to wear a mask. Like as a result, wouldn't you want everyone to wear a mask to stop transmission of anything coming from your mouth?
Right. So let's sort of start with the basics right now. So I'll answer that question from two perspectives. One perspective is right now, first of all, we're having a real bad shortage of masks in this country in particular, but probably worldwide. So this idea of implementing even the mask issue right now is kind of a point that we're way over. Right now, I don't have enough masks to take care of our healthcare professionals, right? The people who are out there on the front lines, right? The issue of masks, when it came up early, is interesting. Certain cultures, and certainly in China, people were wearing masks all the time, right? So what's the proof of that use? Two things. One of which is the standard surgical mask, right? And it's not, there's two types of masks you're going to be seeing out there a whole lot commonly, right? And they're both right now in severe shortages. One is something called the N95, which is like a face mask that covers your mouth and nose that's pretty tight on your body or against your face. And that is a rather thick mask, a little difficult to breathe through. And that mask really is the most protective. So that mask is, you know, basically the 95. We call it an N95. The 95 denotes that it blocks 95% of particles that are 0.3 microns or less. So this is now getting to virus size. So that's a really, really good mask. Again, not recommended for general population use because one, we need it for healthcare workers, right?
That makes sense.
And secondly, for it to work, it really needs to be fit tested. So in occupational settings, people once a year should have a sense of, is this mask, and there's special tests that go on, is this mask really protect me in those healthcare settings? I have a beard right now. I wouldn't be certified to wear an N95 right now because I would have too many gaps around me. Let's go to the surgical masks right now. Surgical masks are the ones, paper ones you see. First of all, they're not great in protecting me. So one of the reasons that we don't want people to have a sort of a false sense of using these masks is there's gaps around, actually, right?
Yeah.
It's not that good in terms of protecting me. Where it does play a role, and this is, again, if we had a ton of these masks, is it's probably best for a person who's sick to be wearing that mask. In that as they cough and sneeze, the bigger particles and even some of the smaller particles that come, you know, from the cough or sneeze get initially trapped in that mask and prohibited from getting, you know, into that sort of space around people. So the mask issue is a big issue right now, right? You know, right now we have a severe shortage. Even hospitals, if you look at the news, hospitals are running out of these things. It's almost strange to see an organization like CDC, that's part of my, you know, my pedigree in public health, to actually have come out with guidance a few days ago to healthcare workers saying, if you've run out of these masks, you can start reusing them, right? That's that's
a little, yeah.
And the other thing is, if you don't have the masks, put on the bandana, right? I mean, that's how desperate things are. And both those things are not good approaches.
Yeah, I saw a few things about that and I was very interested. I saw the bandana approach about putting that around your mouth and everything. So is the bandana better than nothing at all just because it's like blocking some transmission, or should you just go without it?
Well, you know, it's that whole sense is that what I don't want is people to feel like the mask is what it's all about, right?
Yeah.
So the reality is, does the bandana help? You know, it's not the recommended thing, right? So we got a question right now, can you wear a scarf as a mask? The reality is that the bandana is not going to stop those virus particles from getting into you, right? The weave on clothing, on anything, is not thick enough to stop it. So, you know, if you're working in the healthcare setting, you have nothing else, and you have a lot of people that you're up close with, guess what? They're going to have to use these bandanas, and it's not perfect. And I hope everybody understands it's not perfect, but it may be better than nothing. Yeah. The reality for us, the common person out there, I'm not wearing a mask, right? I'm staying home. But what we're recommending is people to stay away 6 feet or more from others, right? Then the mask is not an issue, right? If we're following those rules, right?
So Dean, talking about that, I just was curious, like, what is the university now recommending about students returning to campus to collect their belongings? Because some have expressed concern that this might be putting themselves at risk or like their families at risk, like just returning to campus and not staying home within like these situations.
Right, and that's something that's evolving right now. I know we've been talking with student affairs, a
Hmm.
lot about this, and I know there were various plans, and to the students out there, I understand there's some who don't want to come back, right, that are waiting this
Yeah.
out, others who desperately want to get their things from their dorm rooms, right? Right now, what we're most concerned about is doing the right public health thing. And this is sort of late breaking at this point, in that hopefully you'll hear in the next day or two of sort of what the plan is going to be, right? And don't start yelling and screaming that you need something, right? I understand that something, if there is things that are critical for you to get out of your dorm rooms, out of your apartments on campus, let student affairs ultimately know that this is essential and critical. But there's going to be an
Hmm.
evolution, right? Point number one is we need to maintain social distancing. So it's not going to be like the usual move out at the end of the semester, right? You can't come
Hmm.
in and it's not going to be a mass of people all together. So if and when we do the move out, it has to be a sense of, okay, there's going to be time slots. We need to make sure that you're taking care of yourself, that you're staying away from other people. It can't be a crowding effect. But point number two is this is all late breaking stuff. We know that certain states have already sort of put in, state of New York as an example, has
Hmm.
put in orders of shelter in place, which means no non-essential travel, right? We don't want to sort of say to our New York students, well, we're going to welcome you. No, the reality is right now, everyone's kind of saying, New York, you're in a bad spot, right? This is not a good thing for New York. And in essence, shelter in place there.
Hmm.
Bottom line, there'll be more news coming from student affairs in terms of what the process is going to be. Student affairs has done the right thing. They've consulted with the School of Public Health, who are the experts on campus when it comes to this. They've
Definitely.
consulted with the Prince George's County health officers, right, with the people at the health department, because we are in Prince George's County, and we're monitoring what the governor of Maryland is doing and saying right now. So we have to all fall into lock and step. Ultimately, the most important advice to you students is follow the social distancing and other public health directives. We're here to really preserve your health and to prevent you from also spreading the disease to others. That's what's critical right now.
Hmm. Going off of like the public health aspect of like preventing the spread of disease, a few people have been mentioning the use of gloves and like the misinformation about the effectiveness of gloves. I was just wondering if you knew anything about that or could elaborate on that.
Well, again, is glove use mandatory at all, right? The reality is in
Yeah.
hospital settings, gloves are mandatory because you're going to be touching patients. You're going to have a lot of infected individuals.
Hmm.
Really, what glove use helps you with is going to be what? Is touching surfaces, right? And there's a lot of questions coming up about touching surfaces. So here's the reality. Yes, the bottom line is if I cough or sneeze into my hand and I touch a doorknob,
Hmm.
there are going to be viral particles on that doorknob. To some extent,
Exactly.
there's going to be a dose relationship, right? A real bad sneeze with a bunch of yucky stuff on my hand. Again, sounds gross, Dean, but it's true at times. And I touch
Yeah, that
something,
does.
there's a whole lot more there. So when we talk about surfaces, we're talking about in general surfaces where when you do the studies, you can see that
Hmm.
things can last on surfaces for up to 3 days. They're actually still finding the virus on one of the cruise ships even 17 days later on surfaces.
Hmm.
There's one thing that's different here is it's finding a virus is one thing. Is there enough of it to cause disease for me is the other thing. So
Gotcha.
don't forget, these studies are all sort of swabbing and saying, oh my God, I found it. I'm a disease guy. I'm worried now about human health. So the fact that it's there may or may not be an issue. But let's go back
Hmm.
to this idea of surfaces, right? Do I need gloves? I don't need gloves if I'm doing one thing, which is pretty much when I'm touching things, do I
Yeah.
wash my hands afterwards? The hand washing component of this is critical. People ask,
Hmm.
well, I got a box in the mail. Can it live on boxes? Yeah, for about 24 hours. But I can still open up that box as long as I wash my hands immediately afterwards. Do I
Hmm.
recommend cleaning surfaces? Yeah, if you got some cleanser around, a bleach cleanser, a hydrogen peroxide type cleanser, you can wipe down surfaces that may be touched by others, right? You can be a little bit more meticulous, opening up a public, door handle. Maybe you take
Hmm.
out a cloth that you later wash. Maybe you take a hand towel. But ultimately, it all boils down to these things. These things are bad,
Yeah.
right now. So keep washing them no matter what you touch. And then this is bad if I take that hand to my mouth, right? So in essence, pay attention to this and pay attention to this. And
Hmm.
that solves to a large extent the surface issue.
So, also going off of the surface issue, I've seen lots of questions being sent about like ordering takeout food and stuff like that, or even just like bringing in your groceries. What are things that we can do to prevent the spread of like disease or like even just the virus like amongst our homes or when we're eating things like constantly going into your mouth?
Right, same thing. I mean, if we're getting takeout, there's sort of the custom now is hopefully it's prepaid and you've tipped well. Don't forget, there's a
Yes.
lot of people now who are going to be suffering because they don't have
Hmm.
jobs, they're not making money. So let's think about the empathy thing. So don't forget about the tips, and don't forget that takeout is a viable approach to support our economy. So I'm all for it. You, however, may ask the person, listen, when you come to my door, just leave it outside my door. We maintain the 6 foot thing.
Yeah,
I open
that's
up the
good.
bag, right? I get the bag. I don't know where that bag's been. I don't know if that person
Exactly.
was sick. So what do? I immediately make sure everything's all set to go. I wash my hands. I wash my hands before, after, during, right? This I'm paranoid about. I have my food on a clean plate that I know has been in my house and it's clean. How fun is that I can have a great dinner and taking care of myself because my hands are clean because I've been cleaning them a whole lot as
All
I'm
the
having
time.
this meal, right?
Yeah, that is so true. I should invest in a lotion company after this whole pandemic. But going on to the next question, this one is submitted by Hunter. He says, as you may know, people are going to grocery stores to buy all the essentials and hoarding necessary items. Like, what would you say to those who are hoarding items during this time in a crisis?
Well, be compassionate, right? This is the whole world together. And let's begin with, where our students are, right? You have a community
Hmm.
around. It starts with your family, it's the people in your neighborhood and all that. Realize that if you're hoarding, you're taking away from others. And so the whole
Yeah.
issue really is make sure you have enough of everything that you need, right?
Hmm.
Make sure you have non-perishable foods at home. Maybe it's not going to be what you really want to eat, right? But make sure you have enough so that you limit the number of times you have to leave the house, leave the apartment to go out in public. The hoarding thing has caused massive problems, right? One example, right? It's the hoarding of water.
Hmm.
The reality is there's a 0% chance. I'll tell you right now, I'm a disaster guy, right?
Okay, good. I
In my
like
life,
0%.
0% chance of one, that it's going to be in the water supplies, and two, that this is going to cause such a breakdown of our world that water is not going to be coming in through the taps, right? Water is important
Hmm.
during disasters, but that's where we talk about the natural disasters, right? If this were a
Yeah.
hurricane and water and electricity is out, I don't see us getting there. So water is an example. The whole toilet paper thing, oh, come on, right? There's not going to be a shortage of toilet paper unless we create one, right? The reality
That's
is
true.
there are some food shortages out there, right? Because people have all said, oh, so I went to the store last week with my family, my wife and 2 kids, right?
Hmm.
We went there and we looked through, took a bunch of pictures because it was the non-perishables that were all gone, right? That's the
Yeah, of
advice I'm
course.
giving you. So it's the pastas, it's the canned stuff, right? It was flour because everybody's baking bread nowadays. How cool is that? Buy what you can, buy in small amounts, and replenish as necessary and find substitutes for things. That's what's important.
Yeah, I really like your point about like compassion, especially during this time. I know lots of Terps around us like have to work a lot more to provide for their families, or even just talking about compassion with like delivery service people for restaurants and different like food places. But lots of Terps are feeling these effects like to their wallet and every covered by the university, like housing or dining, and or different things that were covered by student fees that now aren't easily accessible. What are your recommendations for these groups, and are there any resources that we as a community can help out with?
Well, I think again, there's various ways of helping your community. One is,
Yeah.
that this is going to have a major impact, and it has already a major impact on the economy. So,
Exactly.
let's support those individuals as much as we can. And unemployment rates are soaring, right? We're trying to get people back to work, but we can't do it prematurely, despite what the president has been saying of, oh, Easter, so we're going to be all clear. I'm not that convinced, nor should we set those aspirations, right? Look at the way you can sort of support all this, right? Get online, find organizations you can donate time or money to, right? A lot of these organizations are looking for support, right, in various ways, right? Look at the organizations, we're a do-good campus, where there's many do-good organizations out there who are helping, right? The poor individuals,
Definitely.
right? The people who are now unemployed, the people who are going to be struggling in all this. So be generous in this time, right? At the School of Public Health, we're making interactions with local health departments, right? So if you're a student anywhere on this campus, right, let us know, and we can potentially play a role in terms of getting you in touch with people who may need your help. But the best mechanism is not through us. The best mechanism is almost every state is setting up kind of a volunteer system, right? Oftentimes it's called the Medical Reserve Corps. One of the questions, for example, on the Maryland form that I was just filling out earlier today as I was volunteering for the good of Maryland is, are you medical or non-medical? Because in essence is, we can provide that support at all levels, right? You can help, for example, direct traffic into a testing area, right? You don't have to be a medical person. So look at these volunteer opportunities. And so if you do, for Maryland, do a Google search, Medical Reserve Corps, and Maryland, and you can get to an application site that registers you and gets you on and basically asks you about what are you willing to do. This is a perfect time to be volunteerism, right? To take on volunteerism. Does it still mean that we're socially distancing from others? Yeah, the 6-foot rule still applies.
Yeah, I totally understand that. Just to be conscious of your time, I'm going to ask you 2 more questions if that's all right, because I don't want to take up all of your time.
Fun. I know.
Okay, yeah, me too.
We said 30 minutes, but you're the show host, so I am
all right, so
free.
we're going to keep going. Who cares?
Yeah, so let's keep going. And if our listeners are out there, give us a thumbs up if you want to keep going.
Yeah, if people want to hear more, we'll stay on.
If not, why don't you just disconnect if we're boring you?
Exactly. Good. Oh, we could be talk show hosts all the time. I'll be Jimmy Fallon. You'll be the guest star. But from someone, actually a few people in the School of Public Health in particular, they were just talking about graduation.
Are you seeing all the thumbs up coming up, Kelly?
Yeah, I am.
That is
I
good.
love it.
Way to go, Terps. Way to go, Terps. Love you guys.
So people are talking about spring commencement and graduation, and I personally know of so many tremendous seniors who have worked so hard over the past 4 years, and their time at this university, I don't think should just be celebrated over a virtual celebration or whatever. But people are wondering if you'll be allowing School of Public Health people to walk alongside their peers in the 2020 commencement. As a major, as a family science major, students in the graduating class of 2020, achieving this milestone has been a great accomplishment for me. That's what Chanel has said, and she would love to celebrate all of her accomplishments. Eliminating the possibility of walking across the stage and wearing your regalia for an entire graduation class is truly heartbreaking. So are there any thoughts to considering a postponed ceremony rather than just a canceled one or a virtual ceremony?
Yeah, without a doubt. I mean, we're looking at all the plans at present. So first of all, let me, science has a heart, right? And I am devastated with how we're ending up our school year, and specifically for the graduates at all levels, for the undergraduates, for every school and college, for the graduate students, for the PhD candidates. This is not the way any of us, neither you nor us at the university leadership positions, wanted things to end. So that being said, we are looking at all the options out there, and certainly both as a school and I think as a university is option number one is let's look at what we can plan on that very graduation day with a virtual type ceremony. That's not good enough, right? And the idea is let's also look at this idea of at some time in the future to be determined, we need to obviously plan this out, and again, it's not going to satisfy 100% of you because some of you will be in jobs, others will be somewhere across the globe doing good for our world, right? So we're not going to choose the right date, the right time to appease all of you. But I want, for example, my graduates at the School of Public Health to walk. I want them to be there. I want the photos in person. I want to normalize, an abnormal situation as much as possible. Because at the end of all this, you did put in an incredible amount of work. At the end of all this, you were part of the TERP family. And this ain't the way to go, is going to be on the online thing, right? We got to do more, and I dedicate myself to doing more.
That is awesome. I just got the chills. That is amazing, that you're honoring like our terps like that. And I feel like it's really important and it means a lot to the seniors to have that opportunity, even though like this time is very tumultuous and like no one really knows what's going on. Like that's just like something you envision at the end of 4 years. You'll walk across the stage and you'll wave to your family or whoever you love. So I think that that's really awesome that you want to create that environment for students. Just like going off of a question that was submitted, I know you have a background in government, but what do you think of the actions of Governor Hogan has taken to mitigate the spread of COVID-19 in the state of Maryland?
Very proud of him and his sort of step-by-step assessment of all this. Government in general at the federal level, I'll be honest with you, and I was a Fed my whole career.
Yeah.
We practice this, right? We practice this most of my career. We knew that we had pandemic planning always going on. And the reality is that it's no surprise that you fall behind early. This is kind of, there's an analogy saying this is a war. It's a war against disease. And it's much like planning for war on the battlefield. I'm a pacifist, so I don't necessarily think about these things. But in essence is you have plans until, right, as they say, the first grenade is tossed. And all of a sudden, people start going, oh, my God, what's all this planning about? Same thing happened in public health in this case. So what we're seeing at the federal level is, again, there'll be a lot of Monday morning quarterbacking. We're behind, some bad decisions, some bad luck, bad things with the diagnostic testing. And what's happened at the federal level is, in essence, and I'm not sure if this was strategic or just because, is a lot of the burden fell upon the local and states to make decisions. And I think Governor Hogan has done really well, right? He understood the impact of this. We have strong interactions with the Department of Health at the state of Maryland. Fran Phillips, who's our closest contact, she's the deputy there, has done incredible things. She's one of the main spokespersons. She's a key partner of the School of Public Health, and I'm proud of her. I'm proud of the decisions that, obviously Governor Hogan is listening to his public health people. George Askew is here at the Prince George's County level. We have health officers in all the counties that are part of our community advisory committee. So we have a lot of good people out there, and I think the governor's listening to them, and he's acting, right? Doing the right public health thing, and yet trying to calm the people, right? I mean, the idea is, one, the key feature with public health communication is, and this is something we're all taught, and I hope we're teaching it well at the School of Public Health, is go out there, right? Go out there and speak the truth, right? That's what people want to hear. Be transparent, be sincere, be empathetic. Tell people what you know, right? You got to be factual. Tell people, almost as important as tell people what you don't know. Tell them what you're doing about the things that you don't know, right? Just be out there and speak the truth, right? And Governor Hogan, I think, has been doing a great job. Very proud.
Do you think that's been happening at the federal level?
I'm sorry. It was my gut. Okay, so here's
okay.
And I realize this is a partisan answer, but I'm talking as a public health expert on this. Okay. Problem is that what we have and what I'm seeing every day, and it's giving me heartburn, right, are the press conferences every day where we have a blending in of two messages. You have the public health people talking, and they're basing things on what? They're basing things on fact, on data. Here's the information. Here's what we need to be doing. It's somewhat serious, but needs to be empathetic, right? But it's an immediate time frame. Here's what we know now. Here's what we don't know. Here's what we're doing for the good of our nation, right? That's important. I'll be honest, right? Other people who are on that stage have a different time frame, right? They're trying to be sort of the cheerleaders are out for the future, that things can be open-ended, that they're not committing to things, that they offer suggestions, right? This then, when it's combined combined together in one press conference,
Conflicting.
only walks away, the person listening walks away, right, to
Completely
what? To be
confused.
confused, because I
Yeah.
just heard two messages, right? So my sense is, I'm not dissing,
Yeah.
the people speaking. What I'm saying is you got to separate the two messages, right? And you got to sort of be honest. And here's the other person's intent. Don't put them on the same stage together, because we need to have public health messaging that's going out there and that people understand and are not confused with. Because I'm a public health guy. I sometimes walk away from this saying, what the hell did I just listen to? And what am
Yeah.
I supposed to do for the good of my health, my family's health, and for the good of my community's health? What am I supposed to do for the good of College Park and our university community? If I'm confused, oh my God, this is a bad thing.
Yeah, I think going off of that, someone asked me a question to ask you, but what has surprised you about this situation? Talk about you, like, with all of your experience and just like seeing everything like with pandemics and stuff, but like what has surprised you within all of this, or like anything?
Well, it goes back sort of to the basics of all this. First of all, what
Yeah.
surprises me is that we're finally here. And I say that as a public health professional who spent, the good part of the 20th century. Since I moved here in 2004, and before that I spent my years at CDC, but my job really was, from 2004 on, planning for this event. Now, I'm going to remind you, some of our, our listeners today may have been too young to remember this. As 2009, we had H1N1. It was the avian. Remember still very well, I was at FDA running the Office of Counterterrorism and Emerging Threats. This was an emerging threats. I remember my sinking feeling on April 15th. There was a brand new virus, not in China. We were watching China for something called H5N1, but it was in our backyard. It was in California. It was a little kid that was being swabbed as part of a normal study, and somebody at CDC said, oh my God, there's a brand new virus we've not seen before. Okay, so we had a sinking feeling, right? Then 2 days later, and we're now priming. And it's almost weird, right? As a public health person talking to other people, why were we starting to panic after one case? Well, when you have one, you probably have more.
You have more. Yeah.
2 days later, what happened? We had a second case. Another young person, right? 11, 12-year-old kid, 180 miles away from the first kid. OMG. Right? OMG,
yeah.
This is bad. So, but what happened in 2009, 2010, first of all, it was influenza. We were planning for that. It was a different type of influenza, but we had an infrastructure all set. I know how to make vaccines for influenza. We put in, and we all of a sudden had a vaccine within 6 or 7 months. I knew how to deal with this issue, and we were lucky. It wasn't the Spanish flu that killed 60 million people. This killed perhaps 500,000 people, still tragic, still terrible. In the United States, it killed about 12,500 people, but 60 million of us were infected. And so in essence is, what do? We wiped our brow and said, whoa, we got away with this one. Well, guess what? We're in a different scenario, and it ain't looking that good right now. So the first surprise is it's actually happening, right? The second surprise is all these plans are good until you try to implement them. And the major failure, talking about, is the lack of diagnostics, is that we just weren't up to. Early on in the epidemic, testing is critical. So why are we a whole lot of sick people out there over the last few weeks to probably already had COVID-19 disease, right? But in fact, we're being sent home or we're not coming in because the test up on. It's sort of the surprise is that, the system kind of broke down. The other aspect of the surprise, and again, we always knew that the surge effect was going to be a problem, but this whole issue of the mask issue, of protecting healthcare workers, right? It's that whole sense of, so these are the negative surprises. The positive surprises is we have never done social distancing to this level, right? How 18th century concept, stay away from sick people, or even if you're healthy, stay away. We all think we're in the 21st century, which we are, I'll admit, but we don't necessarily have 21st century technology to help us here, right? Everybody wants a pill that we can put in our mouth. Everyone wants a vaccine that we can put in our arm to solve this issue. No, we're going back to basics. Wash your damn hands, stay away from others, right? Don't go out if you're sick, take care of yourself.
So, like going off of social distancing, I know like some people that I've seen, like a few friends, like maybe two or three, and have like a dinner party or something, if no one's coughing or anything. But how extreme do we have to be in limiting contact?
Well, again, so here's why this is important. Doesn't depend on your age, right? We know that young people now in the United States, the data for last week from the CDC, which will change with time probably, was that almost across all age groups, 20% of all people who had positives were getting hospitalized. That means something was amiss enough where a doctor in the setting or a healthcare professional said, you're having problems with your breathing, I'm gonna have to put you in. So first of all, we're seeing serious disease. We're not seeing necessarily mortality, deaths in all age groups. That's definitely in the older population group. For younger people, the bigger issue is, let's say that 80% of all cases, which we know are mild cases. What I don't know is the number of asymptomatic people who may be carriers, because I haven't been testing the whole population or a chunk of the population. So just because you feel fine doesn't mean that you picked up the virus, and doesn't share it with somebody else, right? So worry about this asymptomatic state. So the idea, back to your question, 2 or 3 people gather together who all feel fine. What if one of them happened to be a carrier? What if all of a sudden you're sitting around watching a movie on TV, right, together, and you get it, and you're also asymptomatic? And what if you go visit grandma or grandpa the following day? I'm healthy, I can sort of be there. Now you've caused a problem. Kind of theoretical, and this is what we're trying to achieve. So public a million times in front of you, right? We in public health have to be optimists, and the optimism, if you're a pessimist in public health, you wash out in this career path. And the optimism is, how do we do this right? Guess what? If everyone on this planet, I know they're saying, oh, the dean's being naive, it's never going to happen. Well, again, work with me on this, right? In terms of the optimism. If everybody on this planet stayed 6 feet away from each other for the next 2 weeks, opportunity to be taken care of, so they're being taken care of. The rest of us follow these rules meticulously. About 3 weeks from now, disease only is being spread between humans. If we play the game right, the public health recommendations right, we can actually lick this thing. So back to the 3 people gathered, okay? So get together if you like. Make sure no a place together, stay 6 feet away from each other. Sounds kind of funky, but look at, the space around you, right? Be aware that your hands got to be clean. Be aware that if anybody's sick, they shouldn't be there, right? Small numbers, right, are, it's not a group of 10 or 20. 6-foot rule, boy, try to keep up with that, just to give our people who live here, give deal with this issue, right? That's what it's going to take. This is a team effort, right? I'm asking the TERP team to play along, right? This is important.
Definitely. And I think that's going to bring us to like our last question, which is like, what can we do to stay healthy and connected during these stressful times and uncertain times?
So first of all, and you've probably, Kelly, heard me and other public health students who want to be on this, I always talk about the definition of health, right? Definition of it's complete physical, mental, and social well-being. So if I'm an advocate of being healthy, right, I'm asking everyone to take into account all those 3 aspects. Number 1, physical well-being, right? Keep up with your exercising, right? Eat well, right? Saying, well, oh my God, we're in the midst of a pandemic, no. Have health problems, be cognizant of whether you're a high-risk group, whether you need to be extra careful during this time. If you're on medications, make sure you have enough of these medications, et cetera, right? So take care. The mental health aspect, right? This is a stressful time period. This is really stressful for everyone. It's the unknown. It's invisible. It's killing people, and it's sickening a lot of people. Let's be empathetic, right? Let's understand that this is real and it's affecting the world in a real way. Let's figure out ways that we deal with our anxiety and our stress, right? Let's think through the idea of, what are you doing for the good of relaxing a little bit? Point number one is, and I'm guilty, walk away from the news cycle, right? I'm a public health person. I'm constantly saying, on what's the hope? You got to step away.
You have to throw on Hulu or something. Like, you have to throw on a TV show.
Yeah. So what are my kids doing? So I have 2 college-age daughters, right? Both of whom we were concerned with. I had to bring one back from Washington University. The other's doing a post-bac research thing at NIH. Their lives are disrupted right now. We're all together right now. And this may sound kind of weird. Game board that we haven't played but once. It's been in our house, and now I'm not getting any royalties.
Lushniak, what? But, why are you playing that game out of everything?
It's fascinating because it brings up this whole role of public health. It brings up the whole. It's an educational game, and again, you'll say, oh, that's inappropriate. Well, it's fun, right? And is that what it allows us to decompress a little bit, right? The whole issue of spending time with friends. My preference is you do it through Zoom, through Instagram, through other sources, right? You have the ability to interconnect on a social scale, right? So this social well-being is an important part. Don't let this freak you out, right? I said from the beginning, don't worry, but be wary. That's a silly thing to say. No, that's what be wary means. Be aware. Be up a little bit. Take advantage of what is a golden time. Us sort of being in the self-isolation mode of, oh, this is the worst. Yeah. Think about things that you haven't done, right? Think about things you can catch up on. Next week our students start school again. Dedicate yourself to learning about this. Bring this up as a topic in every class, right? A pandemic and its approaches is public policy, it's government, it's public health, it's biology, it's the arts and humanities, right? It's, philosophy. All this becomes a topic. In essence, find out what we're made of. Are we a resilient people, right? Are we a resilient community? What's family? Can we persevere through this? But, reach out and do something extraordinary in the midst of all this.
Yeah, that is completely agree. I think it's really important that people are, still staying in touch with themselves and like doing things that make them happy, or focus on the things that you can control and work on those, and try not to let like the external stresses, like when you're getting headline after headline about this issue and it feels like it's taking over our daily life. But like as students and faculty and people part of the community, like we need to all work together to like combat this issue. And I just
let's do it 6 more minutes. Let's stop
at
okay,
1300
perfect. Hours. 6 more minutes, because I got a few questions that have come up. I want a direct answer about moving directly to you very soon. We're having a dean's meeting later today, and I'm sure after that meeting we're going to have more of a sense of information. Very, very soon. The other aspect is that I just saw is, what's the grading policy going to be? Again, big dean's meeting today that we're going to be talking that through, and so you will be informed this. So those are two questions that I picked up. Kelly, what else do you got on
Awesome.
your question list?
Um,
6 minutes, folks.
do
6
you
minutes.
think, yeah, do you think at home order would be significant to help the spread?
Personally, yeah. I think this
Yeah.
whole idea that we as a nation need to, because, you know, the way we're kind of dealing with this right now, and again, there's no right answer. Since the way we're dealing with this right now is we're dealing with this as if we're the European Union and we have 50 Union. Yes, the people who are U.S. government and policy majors will say, well, we're a federalist, you know, form of government. There's incredible power within, right, within the state governments, and they should be able to make their decisions. Okay. So let's conclude. Sorry, everybody out there.
People are joining again, so clearly they're happy to be back.
Okay, well, maybe we should do this again if there's a lot of interest. If you want to do this again, people give us a thumbs up, and Kelly and I or others can get involved in putting together another program like this. But so anyhow, let me use the final 2 minutes to praise Kelly. So all this wouldn't have happened without Kelly and her idea.
Not true.
We were thinking about doing something for School of Public Health students, and then Kelly came along from the Student Government Association as, yes, one of our students from the School of Public Health, of which we are very proud, but also the idea of realizing that we have a commitment for our community at the University of Maryland. And so, Kelly, what a great job in terms of putting this together. And, you know, the Kelly Sherman Show, I think, went pretty well for the first time. For me, it's a pleasure to get information out and, you know, and to kind of talk the way we need to talk with people, right? I mean, you know, public health is about people. It's about caring. It's about, you know, telling people that they're doing well and to be truthful when they're not doing well. So that's our goal, is to get the truth out there.
Yeah, and also I want to say that if people still have questions, you can send questions in to the UMD Public Health Instagram, and we're thinking about doing another segment like this maybe next week at the same time with maybe different people on like the Instagram. But we are looking at like writing answers for your questions and putting them on the website as well. So don't think that like just because we didn't answer it, it's not important. It is important. We just probably couldn't look at it, or I couldn't read fast enough, to be honest. So I just want to thank everyone for coming to this. Thank you, Dean Lushniak, for giving us your insight and like talking about this and like, I feel like common everyday terms where people, like, even if you're not a public health student, you still understood what was going on for like the most part. And during this pandemic, like anything we can do to like help the healthcare system to not become overloaded is like such an act of altruism. And like that includes staying at home, asking others for help, being empathetic, and spreading factual information with our peers. And we are so much stronger working on this issue together, even if we are apart. So just thank you so much, everyone, for joining this. And thank you again, Dean Lushniak, for your time.
Great, my pleasure. Way to go, Kelly. Thanks,
yeah,
everyone.
All right.